Good Thursday evening. We begin tonight with another fallout from the pandemic causing issues for so many. Drug shortages directly related to treating COVID patients on the rise in the U.S. and around here. Manufacturers of a drug called Actemra say for the drug shot up 400% in just the last 2 weeks. It is used to treat folks with rheumatoid arthritis and is in high demand now for patients with severe cases of COVID. Our Tristan Lewis joins us in the studio with more on this story. Tristan?
Mark, back in June, the FDA granted Actemra an emergency use authorization to treat severe COVID-19 patients. The FDA says the monoclonal antibody was shown to reduce the risk of death through 28 days of follow-up and decrease the amount of time patients remain hospitalized. It's caused an uptick in demand across hospitals, even here in Idaho.
This medication traditionally doesn't have a lot of use in our hospitals, but obviously with COVID patients, especially as we went to emergency standards of care, that use went off the charts for us.
Hospitals across the nation are seeing shortages in certain medications typically used on people with autoimmune diseases, like rheumatoid arthritis. Hospitals like St. Luke's.
As COVID hit, we gathered as a system, we learned what medications were going to be short, and I feel we did a good job then.
St. Luke's Senior Director of Pharmacy Scott Milner says the FDA's approval of Actemra was a heads up more shortages were on the way. At St. Luke's, there was no limitations in the medication in July, but as August came, that wasn't the case.
We have a process that we follow, one of which is, how do we ration this if we need to? How do we maybe limit some of the starts? What are the alternate therapies that we could use and to make sure that a patient's never left hanging?
The health system did have to give some patients that were being prescribed Actemra alternate therapies, but never had to stop a patient's infusion. Whereas St. Luke's saw shortages, St. Alphonsus Health System says they didn't.
We didn't really normally keep a lot of that medication on hand. And once things started becoming more prevalent in the use of it, we stocked up on what we were carrying.
Nampa Pharmacy Director Lisa Thurman says all 4 of the hospitals began sharing their supplies with each other, so patients in need of the medication were taken care of. Area physicians determine the criteria to use it outside of arthritis.
That way we were able to make sure that we used it on the patients that needed the most.
While there may be a shortage of Actemra at St. Luke's, Milner says there's been other drug shortages for a while due to manufacturing and shipping overseas. He says while many drug shortages aren't going away anytime soon, this isn't related to typical circumstances.
This is more tied to the fact that we saw an increased spike of demand.
And Milner explains when he says alternative therapy for patients, it has been approved and is equally as effective. He also says while the demand is still pretty high, they've been able for the most part to keep up with it in supply, but he still says there is a shortage. And Mark, he tells me more purchases are on their way to help keep up.
There is no end to these stories about how the pandemic has affected so many areas in our everyday life. Tristan, thank you.